Welcome to the EAU podcast. In this special episode recorded live at EAU26 in London, we present GU Cast. In this interactive live podcast session, Professor Declan Murphy and Professor Renu Eapen brought their GU Cast format to the Congress stage. Together with expert guests and audience participants, they discussed updates in prostate cancer guidelines, recent developments in urology, and key insights from the latest evidence, reflecting on their implications for clinical decision-making.
It's so fun to be here, and thank you very much, all of you, for giving up this Sunday evening and turning up for GU Cast Live. It really means a lot, doesn't it?
It does, and we have a lot of people to thank, really, our amazing clinical advisors and our entire crew.
Yeah, and look, we want to acknowledge a few people at the start. First of all, we have really good support for this podcast for the past 5 or 6 years from our educational partners. You see them listed here. And of course, our clinical advisors, Renu.
Yeah, absolutely. So we have a fantastic show today.
Yes.
We've, a whole list of things that we are going to try and get through in the next 45 minutes. We've got Daria Tilke and Gianluca Giannarini joining us to talk about the updated EAU prostate cancer guidelines.
That's right. And we've got Shankar Siva, our own Shankar, a radiation oncologist from Melbourne here at the EAU and a big old friend of the podcast. He loves urologists, isn't that right, Shankar?
He does. And, the Journal Club has been one of our most successful innovations, and we're going to meet the Journal Club editors tonight.
That's right. And then we've also got, it's jam-packed, you get the message. We've got Alberto Briganti here from European Urology. We've got a fantastic relationship with Albie. He's going to give us a quick update on some European urology initiatives.
We're going to invite Yao Zhu, our wonderful China editor, to the stage and have a little chat.
And we know we have some friends from China here in the audience as well, so great to see them. And that's about it.
Oh, no, you've missed the biggest thing of all, the big giveaway.
Yes. So thank you very much. We know there are people in the audience who've submitted videos for our great APCCC giveaway. Yeah, that's right. We're giving away three fully funded trips to the APCCC in Lugano in 6 weeks'
beautiful.
time.
So stay tuned. We're going to announce that right at the end, but let's get on with the show.
Let's get on with the show. So who's up first?
Well, our most popular podcast every year are the updates on the EAU prostate cancer guidelines. And very popular guests, Daria Tilke, Deputy Chair of the EAU Prostate Cancer Guidelines Committee and Chair of the Dissemination Committee, Gianluca Giannarini. We're so lucky to have them here in person with us, so let's welcome them on the stage.
Here they come. Come on, guys. Have a seat.
Daria, Gianluca, thank you so much for joining us. I know we've pulled you away from some important commitments, but it's great because, the EAU guidelines are updated at around this time. So, Daria, tell us, what are the big changes in the prostate cancer guidelines for 2026?
Yes, thank you for the invitation here to your podcast in London. Actually, there have not been major changes in this year's guidelines. As you know, we had changed the EAU risk classification last year with adding the unfavorable and favorable risk to the intermediate category. This year, we updated it slightly so it's conform with the Cambridge risk groups. One of the maybe larger changes is the recommendation for high-risk BCR in EMBARK-like patients. This year, it says to offer these patients enzalutamide plus ADT. Last year, it was plus minus ADT. Seems like a small change, but it's actually a change due to the presentation of Dr. Friedland at ESMO, where he showed impressive overall survival benefit for the combination of enzalutamide and ADT, but not for the enzalutamide monotherapy arm. Apart from that, there are some text changes, not really recommendation changes. For example, we integrated the micro-ultrasonography study, which was published in JAMA, showing that a micro-ultrasound-guided biopsy is not inferior to an MRI-guided biopsy, but there was no real recommendation included yet because it's not really widely available and it's only available in high-volume centers. There needs to be more data about that. The other one is the NeuroSafe. The NeuroProof study was published in Lancet last year, showing slightly better potency rates in the NeuroSafe arm, better early continence outcomes, but questionable how clinically significant it is. A neurosafe technique is very time-consuming, resource-consuming, so it was not included as a recommendation, but in the text. Other than that, maybe for the metastatic part, it can be mentioned that testing, as we also heard in the last session here in this room, is now recommended for the hormone-sensitive disease setting also because of the amplitude data.
Great
awesome.
Summary.
Lots in there, and we will be doing a full podcast in a few weeks about it to dive into it. But Gianluca, you're on the Prostate Cancer Guideline Committee, but you're also chair of the Dissemination Committee of EAU Guidelines. So tell us a bit about that. It's one thing to create all this body of work, but getting the message out is important. Things like podcasts, are they useful?
Yeah, sure. I think the EAU should be proud to have this committee because it is unique in its kind. It was created 10 years ago, so we celebrated last year the 10-year anniversary. And so it's a structured committee in the sense that we are working close with the marketing and the strategy communication office at the EAU. So we explore, like you, I think all the channels, because we learned during these 10 years that you have, of course, to give information through different channels. And so we start with Twitter. You may probably recall James Dow pressing the button and launching the first recommendation on Twitter 10 years ago. And then we went through Facebook, and then we explored the podcast. And so the EU launched the podcast series. I think we had a fair amount of 200, 300 podcasts, mostly covering the updates of the guidelines, the yearly. And so that's a huge amount of work.
Absolutely. Now, Derek, look, I mean, you guys are quite powerful, really. You know, you write these recommendations and guidelines that underpin our practice, but it's not without controversy, is it? I mean, you must get your fair share of hate mail. People who are, a little bit frustrated at the changes, may not quite agree with the changes. And some of these do play out on social media, as we've seen in recent times. Is that not right? How do you deal with that?
Yeah, thank you for that question. We do recognize that there are controversial topics, especially if there are recommendations about changing established practice. If there are challenges which arise, our approach is to communicate openly and respectfully. Throughout the year, we write a lot of editorials and guideline views within the panel, which are published in European Urology, mostly on these controversial topics where we explain the evidence base and the reasoning of the recommendations. We know that debate is a healthy part of the process and that it improves actually guidelines. Ultimately, we want to improve patient care, but we also know that in most cases, a one-size-fits-all approach is not the right way.
Well, you guys have a tough job. So I thought what we could do next, Declan, is I think we should test their knowledge of the guidelines. I mean, it's well enough to write them year after year, but let's see how well you really know them. Don't we have a little quiz prepared?
We do. Now, you might have to look over your shoulder a little bit. There are two quick questions. Yeah.
Okay.
Nothing tricky here. Yeah.
True or false? And this is for Derry and Gianluca. In the 2024 guidelines, this is when you guys kind of took over and took charge, the following statement was retained. PSMA PET CT is more accurate, but don't change your management based on PSMA PET CT.
False.
Is that false? Gianluca?
False.
All right.
It was a bit of a ridiculous statement, wasn't it?
We wanted an easy question to warm them up. All right, question 2. 2010 guidelines, bang, that's going back quite a while. The following statement was made in a 55 to 74-year-old man with Gleason 6 prostate cancer. The 15-year risk of dying from prostate cancer is at 8%, 14%, 44%, or 76%. Daria?
I would have liked to have something lower than 8%.
Yeah. Absolutely, right? 0. Yeah. Gianluca, what do you think?
Again, 8%, but probably below.
I agree. What do you think? What's the answer, Declan?
Any thoughts? Who was on the 2010 guideline committee? Come on. Morgan Rupre. The answer is 44%.
44%.
They weren't very keen on active surveillance back in 2010, the committee.
Gosh, we're lucky it's 2026.
I was a resident.
You're a resident. Very good. Well, there you go.
You couldn't have even expected to know that. Well, there we go. You do know the guidelines after all, at least the current ones.
Let's put our hands together. Thanks very much for all the work you do as well as for joining us on the podcast.
And we look forward to the proper EAU prostate cancer guidelines podcast.
Exactly.
So, Declan, speaking of historical events, it's our 6th birthday.
It is next week. 6 years old.
Yeah.
GUcast. There you go.
That's amazing. And so many of you in the audience have been with us right throughout the journey.
It was very humble beginnings. And actually, we started at the start of COVID in March 2020, but we'd planned it for a few months. We hadn't anticipated COVID, but COVID did kind of give us something to do. The podcast was
absolutely.
Quite cool,
and, our humble days of just an audio-only podcast, would be in a room at Peter Mac. We'd have to hire this room every week.
Yeah.
But so much better now with our studio, and we're able to get these podcasts out so quickly.
So next guest, Shankar Siva. So Shankar, come on up and join us. This is a radiation oncologist extraordinaire from Melbourne.
And someone who's been with us right from the beginning.
Yeah, welcome, Shankar.
Thank you.
He really is, and he's he does love urologists. That was kind of the thing.
And he's the one who goes all around the world and sports our merch.
Yeah, look at him. Check this out.
It's awesome.
Yeah, Pete Ost is up there as well. And we do a lot of radiation oncology on the podcast. I think it's fair to say, Shankar.
What's been your experience with us, the podcast?
So I think the platform, congratulations to you. This is an amazing platform that you managed to make. And I think there's a lot of viewers all over the world who have learned a lot from what you're teaching. You asked me the question why I love urologists. I really do love urologists. Urologists are quite happy surgeons, and compared to a lot of the kind of macho neurosurgeons and those pesky cardiac surgeons.
Yeah.
But I think the good thing about urologists is they're very innovative, and often they'll take the first new technology and implement into their practice. So, it's so innovative. In fact, I think if there was a nuclear bomb to go off, there'd probably be 2 species that survive. It's the cockroach and the urologist that would probably come out.
This is what we have to put up with. Yeah. And he's also trying to do partial nephrectomists out of business and he's got that in your radar as well, haven't you?
Yeah, so there's been a lot of work we've done, as you know, from the humble beginnings with stereotactic radiotherapy for kidney cancer. I think partial nephrectomists, you can relax. It's still going to be the premier treatment. But there's going to be a situation, I think, that when the first treatment's going to be a radical nephrectomy, that perhaps we should be thinking about stereotactic radiotherapy first and potentially salvaging down the track with bigger surgeries. We have a very complementary treatments. And I think there are certain patients that will be better served with surgery always, and some patients that you may think is a higher risk, and maybe we can help out with some radiation.
Fantastic. Now, we've got this, we've so many photos of you, Shankar, and this is one, I think, that from a podcast that we did in your little cyberknife bunker. And we thought we'd do a little competition to see what is Declan saying to Shankar here. Yell out some answers. We've got David around to pass around some merch as a little prize to some creative suggestions.
While they're thinking about it, I've come up with a few. You can't recall ever seeing a late GU toxicity?
Yeah.
It's all about the size of your penumbra. You said that to me one day when we were at the MCG watching the cricket in the bathroom. Why do you try and make radiation sound like surgery?
Cyberknife.
Gamma knife. Stereo. Oh, yeah, we have some volunteers.
Yeah, what about Shankar? I thought radiotherapy just made prostate cancer angry.
Radiation makes cancer angry. Good one.
It's the work of the devil.
Owen.
Do you like my nose?
Do you like my what? Nose.
He deserves a hat.
He deserves a beanie.
He deserves something.
Awesome.
I like that.
The answer actually was the third one on the podcast, I think I recall. That's right.
So, Shankar, you say you love urologists, but, there are some of your colleagues that don't feel so great about us. We've suffered a little bit of, grief in social media. Look at this. These are all your colleagues there.
The Italian urologist has confirmed he fabricated the infographic using AI. Blah, blah. This is reassuring, isn't it?
Yeah.
Time to resign, Morgan. Oh. Is he still here? Morgan Rupert. Yeah. Have you resigned?
Did you see that?
Time to resign.
Have you resigned?
What?
He's walking out.
Radiation oncologists think you should resign.
What do you think, Shankar? We have such a collegiate environment in GUcast and in Australia. What's this?
Yeah, to be fair, I don't think that situation was probably the best time for either European urology or radiation oncology as communities. I don't think we acted, either of us, particularly responsible in that communication, but we can do better. I think, in general, we should try to be respectful, as Professor Dario was saying before, in our communication. Infographics are an interesting one. There's good ways to...
There's the one, and Ricardo's in the audience, I think, right, Ricardo? Yeah, you're in the safe spot.
There you are.
Where is he, Ricardo?
Call him out.
There you go.
Yeah, infographics can be a double-edged sword. It's hard to know exactly how to use them best. My own experience is being with infographics. It's probably not... I'm still figuring it out. AI is like a new tool, and we're all getting, different uses out of it. But I'm figuring that probably asking the AI to do the direct question that you want is possibly not the best way. Some of you may have seen, did a debate yesterday with Walter. And
unfortunately, he's not here, but that was great.
He's watching live, I think, on the train on the way home. Yeah.
So, the idea of asking AI in that question is not specifically about the question about whether surgery or radiation should be the primary treatment for prostate cancer in 2036. The idea was to say, look, I want to make it sound like surgery's full of Neanderthals. It's always backwards. It's historic stuff, and the evolution is to radiation oncology. So I just made this caveman scene, and that was kind of the angle for the whole presentation. But had I asked it to say, what is the best thing about radiation versus prostatectomy, probably wouldn't have worked out.
Yeah. And look, you are such a master chef when it comes to, these AI infographics and creating them and using them wisely. Are there tools you would recommend? What are the 3 big don't do's?
So yes, AI, I think we have to be careful in terms of asking the AI to do something that will come up with inaccurate answers, right? So generally speaking, don't ask a direct question, I think, personally. I think ask an ancillary question, a theme, a feeling, something to colour your presentation rather than to make it. Or to colour your ideas rather than to make it. And that's probably the best way to interact with AI. In the future, hopefully it'll be doing a lot more for us and we can trust it a bit more. But right now, we have to proofread and make sure everything works out well.
Yeah,
pearls of wisdom.
Great advice. And if you get a chance to watch Shankar do presentations or stuff he posts, he
or
really
go back and watch the debate.
And it's not just the AI, it's the way he uses visuals, and he's a great storyteller using PowerPoint and so on. But it's great to have you at this meeting, Shankar, and thanks for all your support for the podcast.
Thank you so much. Thanks for having me.
Awesome.
I love urologists.
Yeah. Excellent.
And we did do a couple of podcasts about this.
We love radiation oncologists. So we did a couple of podcasts to kind of, settle the waters. And
first, we got Ricardo in to talk about, it was called AI and Twitter toxicity. And we invited a radiation oncologist, but he said, what did Shankar say again? Oh, no, we weren't going to name him. No. He said, this paper is a hand grenade.
Yeah,
I'm not going to
touch it.
I'm not going to touch it. Yeah.
It'll blow up.
But then the following week, we got a message from the president of ASTRO, the American Radiation Oncology Society, and our associate editor at European Urology, Amr and Neha, and we had a fantastic podcast with them. So all is nice. Everyone's friends again. Awesome.
Fantastic. All right. I'm going to just go into the audience while you keep going.
Exactly. So GUCast Journal Club we launched last year, and this has been really popular. Monthly format, and we delegated it to 2 senior trainees, to Carlos Delgado from Mexico and Elena Berg from Munich. Monthly format, and it's been really successful. Very, very popular with trainees, and we're really grateful to them. But they're here in the audience, so Renu's gone down to track them down.
I have. They were not too hard to find. They've got their GUCast jackets, but then everyone's got some GUCast merch on, which is great. Carlos, Elena, great to have you here with us. And, Journal Club, like I said before, it's been one of our most successful innovations. It's hard to find people who'll sit down and read a journal article from start to finish these days. So you guys do the hard job of reading it, of summarizing it, of synthesizing the main take-home points. Carlos, I might ask you, are journal clubs still important these days to review urology papers?
Renu, first of all, thanks to Declan and you for having us at the Journal Club. It's our pleasure. I'm speaking on behalf of Selena as well. And I think it's a great way to analyze landmark trials that shape the way we practice urology, and not only take for granted the guidelines, but really do a critical analysis of the data that will, at the end, will help us to make our clinical decisions.
Fantastic. And Elena, podcasts for a journal club. I mean, it's a new concept, right? Well, do you think it works after your experience so far with the GUCast Journal Club?
Yeah, I think podcasts are a great format for journal clubs because it takes the journal club out of the meeting room and into everyday life. Whether you're on a train ride, out for a run, or just grabbing a coffee, you can dive into landmark trials and new trials just along the way.
Very efficient, right?
Yeah.
So, we put a lot of work into deciding what papers are going to be discussed. Declan always wants to talk about prostate cancer, and we have to kind of, tell him to back off. It's a big decision-making process, and we've got this wonderful audience here. So why don't we plan the next journal club? Everyone get out your phones. There's a QR code there, and we have a few suggestions. Pick your favorite paper, and the top 2 will feature in our next GUcast Journal Club. So get voting. Please start now. So the options are radical prostatectomy or watchful waiting in early prostate cancer. This is the SPCG4 trial, the Pro-PSMA study. We love that study. SWOG 337, intravesical gemcitabine for low-grade non-muscle invasive bladder cancer. Carmina, cytoreductive nephrectomy. Or, is that right? Penile fractures? The price of a Merry Christmas. Vote, everyone. We've got a few seconds here. Penile fractures, that's not GU oncology. Did you put that up there? No. All right, well, let's see. Oh, well, still got 20 seconds.
Surely penile fractures is not going to be on GUcast Journal Club.
Is it just at Christmas?
Just Christmas, holidays.
Yeah. This is that BJUI article. Yeah. All right. A few more seconds to get your votes in, and let's see.
Penile fractures.
Penile fractures and Pro-PSMA. Well, there you go. You guys have to present those 2 papers now. That's our next journal club sorted out. We should do this every month, right? Excellent. Thank you, Carlos, Elena. Back to you, Declan.
Well, that's awesome. Thanks so much. And let's give them a hand, actually. They put a lot of work into that journal club. Yeah. Albi, Alberto Briganti, Editor-in-Chief of European Urology, and also the coordinating...
Not oncology, urology.
Oh, sorry.
So I'm not resigned.
Oh, yeah. He's still there. Still got a job.
Still there. Okay. I will ask Morgan to resign
and
soon.
he also sits over the top of the other family of journals. So, yeah, you got the heat on that as well, didn't you?
Yeah. Can you please next time select a paper published in European Urology in the polls, please? So not only New England.
There we go.
Thank you, guys. Thank you.
Okay, you better keep him happy. He's the big boss.
That's for the month.
It's a good journal. It's not bad.
So look, dissemination is a thing you've taken very passionately since you took over, and you appointed us as digital editors for European Urology Oncology, and we create these podcasts. But tell us, we had the editorial boards this week, and you are interested in other dissemination strategies. You're already using some. Tell us, what you're thinking about when you're trying to get these papers noticed.
Yes, I mean, as editor, when we release new data, we like to have the possibility to reach as many people as possible. So we actually are exploring, and we have done already, new ways of dissemination, including these kind of spotlights, which are small and short videos in which we summarize the main results of the study. And then we have several other ways, like we are using infographic in a correct way by using visual abstract that we create, and then we share with the authors. And then once they are corrected and approved by the authors, we actually put them on the platforms. And we are also about to start the use of Avatar, which I believe is quite nice because the editors of the journal may explain themselves the results of the study in a very concise and short way.
Yeah, and Laura Bukovina is in the audience, I think.
She's right there.
Yeah, so
Master of Avatar.
Yeah.
She's the brain.
She is the Avatar queen.
Yeah.
And we've been running the podcast, but we're changing the format up a little bit based on feedback. So we're going to go to a monthly podcast, I think, from next month. Not do them separately, but do them together, more like GUcast. And we've had feedback that having senior editors like yourself and the other editors-in-chief, senior associate editors, is valuable. People like listening to what the senior editors are thinking, what papers they're attracted to, tips and tricks. So you're going to be a regular, I think, hopefully, on this new format of the podcast.
Yeah, it's hopefully not every day.
Yeah.
But yes, absolutely. And can I just take this opportunity to thank you all for what the great work you're doing for the journals. I mean, you're actually doing a great job in doing this podcasting. We understand now that maybe we can do a podcast for the entire EAU family of journals. And what we are doing is indeed having the editors involved that can explain and put into context the clinical trials, all the studies that we are going to show and to discuss. And maybe we can in the future also invite some of these authors to discuss their own study. So it's a mixture between, editors, you guys that you are presenting so well, and in a very friendly way, and maybe some authors who can discuss themselves.
Exactly. And it's great. And I think, that's what really defines you as a top journal is, it's not just enough to publish anymore. You have to be able to disseminate these papers really widely, and journals that have the ability to do these high quality productions. It's really great. So Albie, congratulations to you, Morgan, Christian, Jochen, and the whole European Urology family for all the work you do to make this a fantastic family of journals.
Thank you very much.
Thank you, Albie.
Albie.
Okay, we're getting there. We're nearly
Is
up
it
to...
time for the giveaway
No,
yet?
wait, one more thing, and then it'll be announcement of winners time. But we recognized a couple of years ago that we had a big audience in China, and we travel to China a lot. In Australia, we're very close in many different ways, culturally, academically, economically, to China, and we have a lot of friends in China. Yao Zhu, come up here and join us for a chat. Yao Zhu is from Fudan University Shanghai Cancer Center, and we've known each other for 12, 15 years probably. So when we noticed that we were getting a lot of audience in China, we wanted to reach out to you to understand, what might the Chinese colleagues be interested in, and also, in particular, social media is very different in China. It's huge, and channels like WeChat and so on are very, very important. So we want you to just tell us a little bit about the way doctors and healthcare professionals get their information in China, what sort of platforms, and what are you doing about it for GUcast? Now, Yige is here in the audience as well. Is it Yige Bao?
There he is, yeah.
So Yige Bao has also joined you from West China in disseminating, and we've created this WeChat channel. You can scan that and get onto your WeChat channel. And so tell us, about this dissemination.
Yeah, so first of all, congratulations on the 6th birthday of the GUcast. I'm really honored to join the GUcast and work with you. And I think the Chinese, we have like a huge number of patients, and we have like 20,000 physicians work on the urologic specialty. So it's a huge number of medical need to improve. And owing to the COVID time, we have to have some lockdown. So GUcast, I think it's the only way to get up-to-date information start from the COVID time. And post-COVID, we are really lucky to host you and Renu in Shanghai as one of another home for the GUcast. So the information just spread so fast. And I remember we have cooperated for 2 years, and we have 2 episodes made in Shanghai. We have 40 Chinese experts join the GUcast and specific for the Chinese community. So it's really improved how we understand what's going on in the world and in the international. And furthermore, we can tailor our treatment for the Chinese audience. So it's really, and I still remember we made some mixed Chinese and English. Yeah. Yes, podcast. So it's one of the first in such type. So it's really hip for my colleagues in China. So thank you again.
No, well, thank you, Yao Zhu, and it's been very enjoyable learning from, because I'm not sure many of you travel to China very often, but the acceleration of technology and healthcare in China is mind-blowing to see for me. Surgical robots, it's like the cars, it's like everything, and we are learning a lot from our collaborations with you. So thank you for that, and hello to our Chinese friends. How many of them are here?
I think we were talking about this the other day, Zhu. There's over 400 Chinese urologists at this meeting. What makes the EAU so popular?
Yeah, I think EAU is a huge stage and a fabulous stage for every young and active urologist all across the world. And what I learned as an oncological and a urologist, I see the ESMO and EAU just boom in the recent years. And we would like to travel and learn from the European colleagues and how to improve our technique and how to collaborate in the near future. So I think it's really a very nice stage and a really amazing place to learn and to collaborate and to sharing some knowledges.
Fantastic. Thank you very much, Yao Zhu. We really appreciate it.
Thank you.
All right, Renu.
Are we there yet?
Yes. Does that mean it's...
Yes.
Yes, there it is.
There we go.
That's Lugano behind us, isn't it?
That is beautiful, Lugano. I mean, it's a privilege to do this. I mean, we did this a couple of years ago where we sponsored 3 people to go to this amazing prostate cancer meeting in Lugano. And this time we opened it up to the whole world. So any 3 people from around the world who are either a trainee in urology, medical oncology, nuke med, radiation oncology, or a young, newly minted consultant could apply.
So if you've never heard of this meeting, we have Aurelius Omlin here. Aurelius, come on over. Have we got a microphone for Aurelius? There we go. Kirsten's got one. Yeah, come and join us. So Aurelius, welcome, medical oncologist from Switzerland, and you're the co-chair of the APCCC with Silke Gillison, who was here yesterday but has gone back. So tell us a bit about APCC. It's not like a normal conference, is it?
So we started and were inspired by the Early Breast Cancer Conference, which was initiated in 1978, addressing all the open questions that come with new evidence that we are generating. And in 2013, when a lot was happening in MCRPC at that time, we thought, why not do something similar for advanced prostate cancer? And since then, it's been going every second year with little hiccup in the COVID pandemic. It's not a closed door meeting. Many people think that the consensus is happening behind closed doors and only then published. Anyone can really attend 2.5 days of lectures, state of the art.
State of the art with the world's best experts, and it's very condensed. It's like 7 or 8 minutes. If you're running over time, the Swiss like being on time. There's a cowbell and
a goat bell.
And a goat bell. If you hear the goat bell, it's time to sit down. But it's an incredible atmosphere, and we thought, especially for younger trainees in all those disciplines, you get to like chat to these big leaders. You develop relationships and opportunities to work. So,
and you also have a day of translational science before the proper meeting starts. So really, there's something for everyone at the APCCC. So a lot of interest to young academic surgeons.
And we're showing, we obviously post a few podcasts from there every time we go there. And look, it's such a beautiful part of the world. I mean, it is absolutely gorgeous. And there's Derry again up on the screen.
Yep.
So
we did.
So we did put out this competition. What was the shout again? What did people have to do?
Oh, they had to tell us about their favorite GUcast moment in the past year and why they should be the one to go to Lugano. So, I mean, it was overwhelming to read, to hear some of those favorite moments. I mean, it was really thrilling. And Journal Club featured a lot as well. And then the why you should go. I mean, we had, there were romantic quests.
Yeah.
People wanted to propose.
One of the previous winners did propose on the lakes of Lugano, and that's how he got his ticket.
So, I mean, they're quite entertaining watching these videos. And we had a lot of submissions this year.
We have had over 70 submissions from all over the world. And so the awards committee been looking at these videos yesterday and this morning, and we have picked out 3 winners.
3 winners. So we have picked them out. Now, David is our content and partnerships manager. Thank you, David. We should have...
it's like an Oscar moment type thing. Yeah, we should have done it.
We should have put a drum roll thing.
We should have. Now, some of them might even be in the audience. We're not sure.
We're not quite sure.
You didn't have to be here, but in the scoring system, we did say that if you are at the conference, you did get a bonus point. So, yeah, you have 3 winners there.
And your cash is in the envelope. So if you're in the audience, please come up and we will have a picture with you at the end.
All expenses paid, flights from wherever in the world you are, hotel, and registration sponsored by you.
All right.
It's an amazing initiative.
It's a great initiative. It's very popular.
And thank you for facilitating it. All right, ready? I see some drum rolls. Excellent. The first winner is Gemma D'Adamo,
who is not here because she is a radiation oncology trainee. Here's Gemma.
There's Gemma.
We don't know her.
Gemma.
She's from Melbourne, but we don't know her. But she sent us a great video, didn't she?
And she's a radiation oncology trainee, and she sent us a great video. Yeah.
And as we have a lot of radiation oncology trainees listeners, and it's interesting when we were asking people to pick their favorite moments, it was a lot of radiation topics, like the one where 3 radiation oncologists and a urologist walk into a studio. They were like the 3 horsemen of the apocalypse. You were off doing something else.
Yeah,
and other popular episodes were like the one about radiation cystitis. Does that count as a radiation episode?
That was the one with Yasmin.
Yeah,
that we did here.
We went to the guys,
and
yeah. But it kind of counts. So well done, Gemma. You're off to Lugano. You sent a great video.
All right, second winner is Jonathan Walbaum. I know Jonathan is here.
Jonathan is here.
Jonathan is a urology trainee from Chile. So, Jonathan, please come up.
Yeah. Here you go, from Chile. Great video. Congratulations. Well done, Jonathan.
Well done. Well done, Jonathan. Congratulations. Please hang on the stage.
Come on over here with this. We'll do photos in a second because I'm not sure is the third one here or not.
Let's see. We'll see. Okay, so the third winner, a urology trainee from Barts here in London, Pinky Kotecha. Pinky, there you are. Yes, I suspected she was here.
Well done, Pinky. Well, congratulations. Yeah, she sent us a very nice video.
Oh, she did. Your video was very good.
Well, come on in. Let's have a photo then while we've got everyone in. How should we do this? Will we put, we'll just huddle in, shall we?
Pinky, there's a little...
and you get a beanie as well. You can put the beanie on, yeah. Here we go.
All right.
Off to Lugano.
Very good.
Awesome.
Congratulations, you guys. Well done.
Yeah, and look, it was really, I know people say that was difficult, but there was some absolutely fantastic entries.
We wanted more money, so we could send everyone.
Unfortunately. And we thought, we just send people from London. There was a guy from Germany who said, why should I be sent there? He said, well, I live in southern Germany. It's not very expensive for you to send me. So he might even still get a ticket.
We should
a flight from Chile and another one from Australia. There were some great Canadians, other South Americans.
Yeah.
One from San Diego, etc. Lots from around Europe, lots from Australia. So
yeah, we had our own trainee from Australia say that he met a girl from Lugano.
Yeah, Abdullah. It was a nice try, didn't he?
And he'd like to go and take her out
and
on
he
a
had this
date.
whole thing about signal finding and all that.
The right tracer finding the right target.
The right thing. Yeah, Abdullah Al-Khanati.
What are we teaching them? All right, well, that's that.
Well, that's that. So we've come to the end of this GUcast live show.
Time has gone so quickly.
It has. It's been really fun. I've enjoyed that, I have to say. And look, we're very grateful to you all for being here and also for supporting GUcast. Thank you very much for all of that. It's been awesome. And we'd like to also especially thank Martin Alberson and the committee, the SCO, for inviting us and taking a punt, I suppose, on doing something like this. And especially to everyone from Media Ventures, M Events, Congress Consultants, who've helped us to put this show on as well.
These guys are like magicians.
Exactly.
Anything you want, they make it happen.
Yeah, and especially the tech guys at the back at Media Ventures, they were very tolerant. We said, can we take the whole screen, get rid of the EAU logo, make it blue, et cetera, et cetera. Can we have a handheld camera, et cetera. So thanks very much for everything.
You. And so we look forward to getting back home. Finally, are you flying back through the North Pole?
Yeah, right. I'm not sure exactly. The GUcast jet that we had in the Imagination animation is not available, I think, for the flight home.
So we look forward to getting back home and getting more podcasts out.
Thank you very much again, and enjoy the rest of your evening. Thank you.
Thank you for this insightful episode. We are sure our listeners enjoyed it. To keep up with the latest EAU podcasts and stay informed on the urological advancements, be sure to subscribe to our EAU podcast channel on your favourite podcast app. Until next time, keep learning and stay inspired.